Hi, Andrew Corbett, Hygienic OT Australia here again. In today's video, I want to discuss basic fundamental hand hygiene procedures to assist all Australians to maximise hand hygiene protection for themselves and those that we value most, including our families, our friends, and our communities. Firstly, I just want to state with much frustration the absurd present level of misinformed, hysterical panic buying of items including the toilet paper, bottled water, canned goods, rice, pasta and facial tissues, etc., spread across our newspapers and our TV screens daily. Absolutely serves no plausible purpose during the coronavirus situation. In actual fact, the coronavirus, like the common cold, influenza and pneumonia, are all upper respiratory illnesses and therefore have no direct impact on increasing people's bowel movements, certainly not increasing levels of dehydration, nor will it increase levels of hunger. Likewise, the wearing of face masks by the general public is really not all that necessary, as most won't stop cough and sneeze droplets from being inhaled due to their inability to completely seal around the wearer's mouth and nose regions. Although, having said that, the one positive benefit of people wearing a face mask is that it prevents the wearer from touching their mouth and nose regions, as these are both key entry points along with the eyes and ears that bacteria and viruses must reach to gain entry to the lungs. Surprisingly, most people simply don't realise they in fact touch their faces over 90 times or more every day. Hence, it's essential that good hand hygiene and cough and sneeze etiquette be observed at all times. Good, effective hand hygiene procedures comprised of both hand washing with soap and water for a minimum of 20 to 30 seconds, thorough rinsing, not just simply wringing, and drying completely before applying hand sanitizer are currently university recognised. In fact, globally, most health departments utilise identical wall charts, graphics, and wordage. They simply have them produced in their respective languages. By simply following basic common sense hand hygiene and cough and sneeze etiquette repeatedly throughout the day, we can significantly reduce potential infection rates. Now, I understand that this might sound fairly straightforward, but in fact, it is one of our biggest ongoing challenges. Here in Australia presently, as with most of the first and second world countries, reported rates of hand washing across all age sectors within their general populations are absolutely awfully low. In Australia, for instance, just 3 in every 10 people, whilst amazingly 8 in every 10 people happily go about using their mobiles, their tablets, their laptops whilst in the toilet. So it's really easy to understand why the spread of infectious illnesses and diseases, including the coronavirus, are so high. So one must simply ask, why is it so difficult to get people to routinely and effectively wash their hands and apply hand sanitizer? I believe it to be, as identified and experienced throughout my 40 plus years of work today, a combination of laziness, ignorance, attitude, religious beliefs, etc., and coupled with the fact that unfortunately what can and does make us ill are invisible to the naked eye. I often, when talking to people, get a wide range of reasons. I always call these excuses as to why they don't always wash their hands or apply hand sanitizer. Some of the most common reasons include, but are certainly not limited to, oh, I'm running late preparing and cooking the evening meal, or I need to get to the bank or the bakery or the supermarket, etc., before they close, or I'm picking up the family to go shopping to the movies or to the school fete, and I just simply don't have time. Or I've got to check so many patients before my shift ends that I often just forget to get my work done. Or I'm always busy, so I just simply forget. Or I simply can't find the time. Or my hands look clean, so I didn't see the need, etc., etc., etc. So how can we assist people to help themselves and their loved ones to maximise their hand hygiene protection? preferably one that's very easy to do and just once a day, and conveniently before leaving home. Well, the simple answer is to use or seriously consider using an alcohol-free hand sanitizer, such as our Hitos 12-hour hand sanitizer. It provides identical 99.99% protection as common instant alcohol-based sanitizers provide. However, it is for up to 12 hours with just one application. It's independently tested and proven, certainly far more cost effective. It's non-flammable and does not dry the skin, nor will it continue to inflame painful dermatitis. So seek out other alcohol-free products when you're next at your supermarket or your chemist and compare for yourself. So the question that I simply pose to you is this: do you want to continue using an alcohol-based hand sanitizer that must be constantly reapplied numerous times throughout the day? Remembering it only provides protection for a maximum of just 30 seconds. Let me restate that: for just 30 seconds. Or why not simply have each family member apply our 12-hour alcohol-free hand sanitizer before you leave home, and knowing that you and all members of your family have effective hand protection for up to 12 hours before reapplication is necessary, and certainly at a fraction of the cost. The choice is yours. If you'd like to know more, have questions, or simply want to begin protecting yourself and those that you value most by ordering your hand sanitizer, simply call me 0412 556 150 or email me at andrew.c@hitos, that's hitoz.com.au, where I will be more than happy to assist you. Well, that concludes today's discussion, folks. So until next time, remember, healthy hands, healthier you, and it really does begin at home. Thank you.